It's Wednesday, February 24, and time for your Barbados Today Evening News Update. Too many families are ending up at the island's coronavirus hospital, and authorities fear that some Barbadians are still not doing all they can to help break the chain of infections. Manager of quarantine facilities for COVID-19, Alvin Hart, today warned the worrying trend is being driven by persons awaiting COVID-19 test results who are still mixing with family members instead of quarantining.
After persons are tested, they're going home, but they're going to stop by the shop. They're going to go in the supermarket. Some people get tested and don't see anything, know they've been exposed, and they go back to work. And they go on the block. And some of these areas, these villages and so on, are so densely populated that when you go on a block and you have 12 men on a block, or you go in a shop, or you go and visit your aunt, your mother. I heard cases of persons saying, well, when they finish this test, I'm going to look for my aunt. I'm going to look for my sister. I'm going to look for my mother. You are now exposing all of those persons to COVID-19. And when we look at the data, we are picking up entire families because of this.
Mr. Hart advises Barbadians who cannot quarantine at home that they can have access to other arrangements.
We at the Ministry of Health are encouraging persons to state to the provider or to the polyclinic, wherever you go, that if your living conditions are not good, especially if you know you are primary contact and you had very close contact to that person who have tested positive, you should let them know that my conditions at home are not conducive for me going back. If I go home, I put my entire family at risk. We want to break this chain. We are seeing too much every day. Every day we are picking up entire families, 5 people, 6 people in a household, 7 people in the district. And we want to break this. But everybody must come on board.
The Princess Alice branch of the Barbados Agricultural Development and Marketing Corporation has been closed until Monday, March 1, after 4 staff members tested positive for the COVID-19 virus. However, Human Resource Manager Torian Roach says there's no need for alarm and the closure will not impact government's care package program. He pointed out that the care package operation has not taken place at that location over the past 2 weeks. The building will be sanitized and other staff members will be tested. Roach noted that staff members are anxious and concerned, but he says management continues to provide support and will ensure that the protocols are followed. Meanwhile, the island recorded 55 new positive COVID-19 cases from 677 tests conducted by the Besta Santos Public Health Laboratory on Tuesday. 23 men and 32 women made up the 55 cases. 8 were already at Harrison Point, and the remaining 47 are Barbadians. Active cases are 783. Overall, Barbados has 2,907 confirmed cases. 2,092 persons have recovered from the virus. Meanwhile, vaccinations continue to rise. 22,037 people have received the AstraZeneca vaccine so far. In other news, an assurance that the new Barbados Digital ID will not have any personal medical data. So says Senator Kay McConney, Minister of Innovation, Science and Technology, as she made her contribution on the Barbados Identity Management Bill today in the upper chamber. She made it clear that the card will only have the relevant data needed to identify the holder.
Your full name, your ID number, your date of birth, your sex, your nationality, your date, the date of expiry of the card, your photograph, your signature, nothing unusual. What will also be answered would be other data such as your residency status and your, for example, disabilities.
There's regional and international news after this short break.
Barbados Today, news you can trust.
In regional news, the impact of the COVID-19 pandemic was a major talking point among CARICOM leaders at today's opening session of their two-day 32nd intersessional meeting being held virtually. CARICOM Chairman, Trinidad and Tobago's Prime Minister Dr. Keith Rowley says there's no mistaking the devastating impact of the pandemic, but CARICOM has played an invaluable role in the fight against the virus.
The continued support provided to our community by our regional institutions, led by the Caribbean Public Health Agency, CARFA, and the most fervent demonstrations of regional solidarity through the sharing of PPEs, our personal protective equipment supplies, reagents and test kits, and most recently, vaccines, have had significant impact on our ability to combat the ravages of this nefarious disease. The generosity of the government of Barbados and Dominica in sharing their vaccine gifts received from the government of India is particularly noteworthy and commendable. Prime Minister Motley, your pioneering role in securing the community's access to vaccines through the African Medical Supplies Platform, the AMSP, showed great ingenuity, foresight, and stamina. Allow me also to express my sincerest appreciation to the governments of India and of the African Union for the benevolence and allowing us a pathway to access much-needed vaccines to safeguard the health of the people of our community.
Dr. Rowley expressed disappointment over vaccine availability, but he's optimistic the Caribbean will soon receive its first shipments.
I also acknowledge and welcome the comments made by the United States of America, the United Kingdom of Great Britain and Northern Ireland, France and Germany to the global mechanism COVAX and to equitable allocation of vaccines. As we meet here now, we are all anxiously awaiting our first shipments of the life-saving vaccines from the COVAX equipment. We welcome the news today that Ghana has received its first shipment as the first country to have received an allocation from the COVAX. There is hope for all of us.
Further afield, COVAX, the World Health Organization's vaccine sharing scheme, delivered its first doses to Ghana today. More in this report from Reuters Television.
A flight carrying 600,000 doses of AstraZeneca vaccine arrived in Ghana's capital Accra, the WHO and UNICEF said in a joint statement, kick-starting a campaign that Ghanaian health officials said would prioritise frontline health workers and others at high risk of infection. COVAX was launched in June to prevent poorer countries from being pushed to the back of the queue for COVID-19 vaccines. Nevertheless, wealthier nations have since bought up billions of doses and forged ahead with mass immunisation campaigns. COVAX wants to close a politically sensitive gap by delivering 1.8 billion free vaccines to less developed economies, with the aim of inoculating up to 20% of those countries' populations. That's not enough, however, to achieve herd immunity. And on Tuesday, WHO Director General Tedros Adhanom Ghebreyesus urged wealthier nations to share their vaccines, saying that the goal of equitable distribution was in jeopardy.
210 million doses of vaccine have been administered globally, but half of those are in just 2 countries.
According to a Reuters tally, Ghana has suffered more than 80,000 infections and 580 deaths. Africa's reported death toll passed 100,000 last week, a fraction of those on other continents, but rising fast as a second wave of infections overwhelms hospitals.
That's news, but for the very latest, visit our website at www.barbadostoday.bb. You can also subscribe to our e-paper, email updates, or like us on Facebook, and sign up for our breaking news alerts via WhatsApp. We're also on Izumi Media and bus terminals, as well as screenplay at supermarkets and gas stations near you. You can also hear us on Mix 96.9 FM and Capital Media HD 99.3 FM.